Breast cancer is the most common cancer in women in the U.S., but they may not realize there are many different types of breast cancer.
Each cancer is very different from the other, so essentially behaves as a very different disease in each patient. And there are several different kinds. So we categorize breast cancers as hormone receptor positive or negative and HER2 positive or negative. And the positivity or negativity of these receptors tells us about the behavior of the cancer, the type of the cancer, and also this information helps us pick up a treatment option for each patient.
HER2-positive breast cancer accounts for nearly 20% of all diagnoses, and treatment is challenging for patients.
One challenge that we have in oncology is that our treatments take a lot of time. So when people have HER2 positive breast cancer, typically these patients come into our cancer center and spend hours and hours to get their treatment. So sometimes it can be more than half a day because most of these treatments are done through an intravenous route.
But there are new developments helping cut down treatment time.
We have been able to develop some new medicines, and one such example is a medicine called Phesgo, which is a combination of two medicines. And in the past, we were doing these medicines as IV, and it will typically take 2 to 3 hours to administer these medicines. But now we can administer the same medicine with the same effectiveness over 5 to 10 minutes, subcutaneous injection, which is under the skin injections.
Knowledge is power, so here are the key questions patients should be asking their doctor after diagnosis.
Number one, what type of cancer do they have? What are the treatment options that are available? What are the side effects of the treatment? How these treatments will affect their lifestyle? What are the short-term and long-term effects on their health from these treatment options? While they are going through the treatment, what are the things they need to monitor? For example, some of our HER2 positive targeted medicines, including Phesgo, cause some side effects like cardiomyopathy, which is a condition of the heart that we closely monitor when patients are on treatment. They can also cause diarrhea that we closely monitor. Sometimes inflammation in the lungs can happen, sometimes fatigue and weakness can happen. And what will be the monitoring parameters that will be laid out by the doctors? How are we going to monitor and address all those side effects?
You can get more information on the American Cancer Society website and details of the new treatment option at phesgo.com.